when young girls come for abortion, I genuinely think as gynecologists, we have no option but to offer them the right advice, get the abortion done. I would really advise all the young generation to use. Most of the times, the couples nowadays that I see, especially the younger lot, if they are using condoms, they do not check post-sex if the condom has ruptured or no. I commonly use this sentence, and I really wish to tell the world, when we use one sleeping pill, we fall asleep. But when we take 20 pills at a time, we all know the consequence.
Namaste everyone, welcome to the podcast. Myself, Inshara Mustafa, I'm a consultant clinical nutritionist at Motherhood Hospitals, Narang. So today we are going to discuss on a topic which many women want to hear, but they are still hesitant or they're a little worried to ask or seek advice for. So joining with me is our consultant, Dr. Payal R. She is the leading consultant obstetrician and gynecologist in our hospital, and we will be discussing on the topic of contraceptives or family planning today, which most of y'all want to hear. And I would love ma'am to share a piece of advice on this topic. So welcome, ma'am.
Thank you, Dr. Inshara. It's a pleasure that you have called me today. And it's really a topic which I really like to talk about.
So, ma'am, we nowadays, as we are seeing a lot of increase in the relationships, and people and especially the young generation is very much into having unprotected sex or something. So, what are your views on unmarried girls coming for abortion?
So, yes, Dr. Inshara, you've touched a topic which is really sensitive to my heart. When young girls come for abortion, I genuinely think as gynecologists, we have no option but to offer them the right advice, get the abortion done. But every girl who undergoes abortion undergoes a lot of mental trauma. It is only she knows what a young body goes through. So I really tell everybody out there, I take lectures in schools and colleges also, that abortion should definitely be avoided. Contraceptive should be practiced rightly so that we avoid all these abortions. So, how do we prevent abortion is by using the right form of contraception. So, even in young girls, once they attain the maturity after 18, 19, if they're into sexual activity, they should start using condoms or the contraceptive pills, the regular monthly pills, which comes in a pack of 21 days, or condoms. I would really advise all the young generation to use condoms because it not only prevents pregnancy, but it also prevents from all the sexually transmitted diseases which come as a package with relationship. You do not know about your partner. You do not know of how many relationships he has had in the past. And you may just end up getting HPV virus in your body, which may be a beginning of somewhere to fear of cervical cancer later. Or you may get sexually transmitted diseases. You may get genital warts. So when you use a condom, you definitely get protected from everything else. So ideally, first option is condom. If not, then you should use the monthly pills.
Sometimes couples use contraceptives, okay, and still pregnancy happens. So why do you think this pregnancy still happens?
So what happens, Dr. Inshara? Most of the times, the couples nowadays that I see, especially the younger lot, if they are using condoms, they do not check post-sex if the condom has ruptured or no. Ideally, after every sexual act, the condom has to be checked if it has ruptured or leaked. And most of them are using the eye pill. So if by chance a condom leaks, the only option that remains at that time is using an eye pill. But the public generally does not know. I commonly use this sentence, and I really wish to tell the world, when we use one sleeping pill, we fall asleep. But when we take 20 pills at a time, we all know the consequence. So when you take the monthly pill, which is in a minuscule dose, and it is taken for 21 days in a month, it is in the sync with the body hormones. So it does not cause any side effects, major side effects, especially a little acidity or something here and there, okay. But the cycle does not change, the body does not change because it is in sync with the body hormones. But if you take the eye pill has a whole mountain of side effects. So ideally, eye pill should be avoided. Now, what eye pill does is you pop a pill, you have sex after 2 days, again you pop a pill. I see couples, they are out on a vacation and they are popping eye pill morning, evening. So when you take eye pill recurrently, it starts causing the women to have a pigmentation of skin, period cycle becomes irregular, you get a lot of acne, you get hair fall, you get under eye circles. Most importantly, the body starts changing, wherein you see a lot of hormonal changes, mood swings, and intolerance to pain or heavy bleeding or no bleeding. So all this abnormality starts because you are just giving the body shock, like you are giving hormone, then you're withdrawing, giving hormone, withdrawing. So ideally, it's not a good thing to have an eye pill. Also, I would want to tell you here is eye pill is called as emergency contraception. What do we mean when we say emergency? Emergency means to be used in an emergency. Emergency can occur once in 2 years, once in 10 years, not on a regular basis. So eye pill ideally should be kept only and only for emergency purpose. Ideally, it should be either using condoms or it should be using the regular monthly pills.
So, ma'am, earlier in one of your answers, you have mentioned about the HPV virus. So, ma'am, can you shed light on it and the vaccine and everything regarding it?
Yes. So, HPV virus is the human papilloma virus, which is the commonest cause of cervical cancer. If I really want to say, cervical cancer in India, every 30 seconds, one woman dies of cervical cancer. It is that common. And the entry mostly is through the vagina because of sexual activity. Either the girl, the lady, or her partner, either one should have multiple partners. Usually, that is when it is commonly caused. No doubt, even with one partner, it can be caused, but ideally, that is the most commonest thing. Now, what do we do? How do we know if the virus is there in your body? So, the important thing is you test yourself for the HPV virus. There is a test which is called as pap smear in common language. The more scientific or the more latest term is doing a LBC HPV DNA test. Everybody above 30 ideally should be doing it. I would say everybody once exposed to sexual activity should do it. In younger life, till about 40 years of age, you should do once in 5 years. Once after 40 years of age, you should be doing it every 3 years and not needed to do the test after 60 years of age. It's a simple test where a lady comes to our OPD, we take a vaginal swab and send it to the lab for testing. The report comes within 1 week and it tells us also if which it is positive or not, and also it is positive to which type.
Does HPV virus only cause cervical cancer?
No. So HPV virus not only causes cervical cancer, but it may cause all cancers related to the reproductive system. It may cause penis cancer in the males, scrotal cancer in the males, or it may cause the cancer of the throat or the vagina or the vulva. So yes, it can cause multiple cancers, which are again very, very common. Also, a lot of people think that this is only related to the females, but I just mentioned a while back that it can cause cancer in the males as well.
So, ma'am, for cervical cancer, we have vaccines available. Can you shed light on the period of vaccination? When is the ideal time?
Yes. So in India, we have 3 types of vaccine for cervical cancer. The best is Gardasil 9. It protects you from all the major types of HPV virus. It also prevents from genital warts, but it is very, very expensive. The roughly around 11,000 per shot. The second is the Gardasil, which is a very, very old vaccine. probably more around 20 years in the market. Now, Gardasil protects only from four major types of the HPV virus, the more critical types, which are usually known to cause serious forms of cancer. And then there is Servavac. Servavac is just launched recently, about a year and a half ago. Servavac is much less cost, around 2,200. Gardasil regular is around 4,000. But Servavac is recently launched and government probably plans to introduce as a regular vaccination program. If you ask me, I would definitely recommend Gardasil 9 because more protection, the better. Now, who can take it? We can start giving the vaccine from 9 years of age up to 45 years of age in all the ladies. In boys, though abroad they are giving it for all ages, in India, the Medical Association recommends currently only up to 15 years of age. So from 9 to 15 years. For boys as well as girls, from 9 to 15 years, there are about two doses. Whichever brand you choose, it is two doses. If you take the first dose today, second will be taken after 6 months. For everybody who's above 15 years of age, it is three doses. If you take the first dose today, second will be after 60 days of the first dose, and third dose will be after 180 days of the first dose. That is roughly 6 months.
So, ma'am, is HPV vaccine recommended in pregnancy?
No. So HPV vaccine is definitely not recommended in pregnancy. Suppose you have taken the first dose and any one of you get pregnant. So then how do we do it? So the WHO recommendation is to complete all three doses within a span of 1 year. So if you have taken the first dose and somebody gets pregnant, we complete the rest of the schedule after the delivery happens immediately. So if you have taken the first dose, there are no studies yet available to see if it does cause any abnormality in the fetus, but the WHO does not recommend it. So we either give it postpartum, all three doses, or if one or two doses are done prior, we'll complete the remaining doses immediately after delivery happens.
Ma'am, speaking of cancer, so breast cancer is increasing in women. Okay. So what do you think is the reason behind the increasing trend or surge in breast cancers?
So there is definitely more awareness. Now, watching the reels or because of awareness, even young girls we see are regularly palpating their breasts. They know that they have to keep a check, and even a small lump ideally should not be neglected. So, why it is more common? Because more testing is happening. Earlier also it was happening, but people would neglect if there was a lump. Now, what happens is all the ladies who are, especially if there is obesity, or mothers who are very, very young, or very, very elder, or who have never breastfed their babies, somebody who's either not got pregnant or got pregnant but not fed the babies, or who has chronic illnesses like tuberculosis, or where the immunity is compromised, or people who have metabolic disorders like diabetes, or then young girls, even who are into smoking or alcoholism, they are more predisposed to the breast cancer. But summing it up all, I would definitely say the biggest causative factor is the genetic one. Usually it runs in the family. So close blood relatives can get it. And it's not so that only women get it, breast cancer can happen to males as well.
So, ma'am, speaking of awareness and health checkup, one scenario that happened with one of my friends is that she went for a complete body health checkup, and she was not allowed, or she was not given the option or allowed to do basically the mammogram. So, ma'am, what do you think? Why was she not allowed, or is there certain restrictions on why was she not?
Okay, so what happens is mammography has radiations. So ideally, there should be no exposure to radiation. When you are exposed to radiation multiple times, like dentists who do regular X-rays, or X-ray technicians, or all the radiologists who work in X-ray departments or the scan department are regularly exposed to radiation. They are more predisposed to the cancers. So because mammography has radiation, ideally it is not recommended below 40 years of age. So for everybody who's younger lot, suppose somebody has cancer in the family, like Mosi or Bhua or mother or grandmother has cancer, all those girls should start checkup early. They should be called to the clinic, taught a proper breast examination, which ideally should be done with the flat of the palm. And if any lump is noted, they should be notified to the doctor. They should seek expert care, and they should start a regular sonography, which can begin probably at 25 or 30 years of age. So I tell all my patients, do a regular breast sonography once in 2 years or 3 years with your regular health checkups. Once they are 40 years old, then ideally the mammography should be done. So then how common the mammography? Mammography should be done once in 5 years, not lesser. So somebody who has history of breast cancer in the family, or suppose a lump is diagnosed, but a test has been done to say the lump is not to be worried of, it is a fibroadenoma or a lipoma, and they want to do a regular checkup, also they should do a yearly sonography, which is enough. If need be, only then mammography should be done.
So, I'm speaking of a scenario right now. One of my sister's friend, she's ideally, 38 years old right now, and she went to her gynac for a checkup, and the doctor has recommended the removal of the uterus surgeries. So, she was ideally discussing this case with me, and looking at the chart or something, we did not find any, uh, you know, situation where the surgery or probably most noticeable thing where the surgery is not to be should not come into picture. So how? So what are your views on that? Does she require the surgery?
So, Dr. Inshara, the thing is, removal of the uterus, which we call as hysterectomy in our scientific terms. So, I have not seen the papers, so can't comment on whether it is justified or not. But what happens? Usually, hysterectomies are recommended around the perimenopausal age or the menopausal age. Suppose a woman is not attaining menopause, she's 52 or 53 and yet continues to have period, or she has big fibroids more than 6-8 centimeter in size, or multiple fibroids. Usually hysterectomy is recommended when she has bleeding issues, very, very heavy period, or very, very painful period. What happens if there are fibroids? The uterus gets weight, the uterus becomes bulky, and it starts compressing the urinary bladder. It also poses a lot of problem on the digestion because there's heavy weight constantly on the intestines. So these are the times when the woman has some heavy bleeding or recurrent pain or difficulty in walking or moving around, or constant heaviness in the stomach, or pressure symptoms on urine, can't control the urine, or multiple other symptoms, then usually hysterectomy is recommended. Now, in this particular case, she could have had something called as adenomyosis or endometriosis, or her CA125 level could have been very, very high, which is a cancer tumor marker, or then her mother could have expired or would have had suffering of, or somebody in the close family, blood relative, would have had uterine cancer or endometrial cancer. This is when probably early removal is recommended. So I do not know, but probably she would be having one of these symptoms, because if a woman comes to us at 38, usually we give treatment options, but probably she was on the path of getting one. That is why probably she would have recommended hysterectomy.
Thank you, ma'am. Thank you so much for such an insightful session. And I think we have touched almost all the points that were very much needed for us to be enlightened with the seas of knowledge. And we were truly grateful to have you on this podcast. Thank you so much, ma'am.
Thank you, Dr. Inshara. It was my pleasure to have spoken on the regular topics, because these are the things which all women hesitate to talk. And if I can touch even few women every day by these topics, and they can go to their doctors and address their concerns, I would really feel happy. Thank you so much.